When it's time to treat your anxiety. I look forward to reading this because I have years of experience in anxiety disorder and panic disorder. So hopefully it'll shed some light on some good information, and I'll share my own personal experience along the way if it seems to benefit. If you're supposed to feel anxiety during dangerous or stressful moments, how do you know if you need anxiety medication? I will tell you from experience, almost never, unless you have some reason for taking it to save your life. If you have something so debilitating that you need to take it in the short term to protect yourself, but almost never do you need anxiety medication, and I'll tell you why in a bit. Almost everyone experiences anxiety at some point in their life. It's the way our body lets you know you're in a challenging situation, fight or flight. Brief feelings of uncertainty and anxiety can be beneficial and can encourage personal growth. True, fight or flight is also important, and anxiety is important because it keeps us on our toes. It makes us sensitive to our surroundings. Super important if you're in a bad neighborhood or in the jungle, or when you're driving, when you first start driving, all your senses are on heightened alert because you want to make sure you don't run anyone over. So super important to have some anxiety. You may even have some anxiety when flying, but we're going to see where the line's drawn between healthy, normal anxiety and a disorder. However, when those feelings linger and start to impact your daily life, you may wonder if medication is the answer. Anxiety that interferes with day-to-day functioning or affects work, school, or social life may be symptoms of an anxiety disorder. Absolutely. Most diagnoses have done anytime in terms for mental health. It's usually one of the key areas of whether or not you're diagnosed is if it negatively affects your life. Like for me, it did. I couldn't work. I couldn't do anything. I became agoraphobic. I couldn't leave the house because out of fear that I would have a panic attack in public. And so sitting around worrying if you're going to have a panic attack creates a panic attack. So I couldn't work. I couldn't do anything. I just stayed in the house. And when my fight or flight would kick in, I would go for a walk. That's usually why people who feel anxious, they need to go walk. People who have panic attacks, it's important to walk because if you fight, the fight or flight kicks in and you can't walk and there's nothing to fight, then it can make it even more powerful, like more pronounced. So if it affects your day-to-day functioning, you may have a disorder. This interruption in daily routine is often the point at which treatment interventions are not needed, especially at the onset, especially if you're just now experiencing anxiety disorder and it's early on and you see that it's negatively affecting your life and your work. Now, of course, if this is going to make you homeless, then maybe in the short term, you can use medication, but even then you don't need medication. And I'm not giving medical advice. And if you're on medication, by no means am I telling you to get off the medication. That can be very dangerous. But work with your doctor to get off the medication in conjunction with what I'm going to tell you later on how I cured my anxiety disorder and panic attacks that I had for about 14 years. This interruption in daily routine is often at the point at which treatment interventions are needed. The type of anxiety you're experiencing plus any co-occurring conditions like depression will determine your individual treatment plan. Treatment typically starts with a conversation. This may be with your primary care doctor or a mental health professional. I had a doctor appointment. I had no idea what was going on with myself. I was having major panic attacks. No idea what was going on. And I went to a doctor, and within 10 minutes, he prescribed me Zoloft. So we didn't have a conversation. It was just, hey, I went to the ER, thought I was having a heart attack. Everything turned out normal. The doctor in the ER told me that I most likely had a panic attack and to follow up with the doctor. And here, within 10 minutes of seeing this doctor, he was prescribing me Zoloft. Took the prescription. I was maybe a week into it. I thought I was feeling better. But I also have experience in took psychology in school and everything. And so I thought, well, you know what, maybe I just need to talk to someone. So at that time it was the Yellow Pages. I looked in the Yellow Pages, found a behavioral therapist, and on the phone he told me, when I told him I was on Zoloft, he said, "How long have you been taking it?" I said, "For about a week. And it seems to be working a little bit." He said, "Well, it takes 2 weeks to uptake into your system. Get off of it right now. If you were my brother or my kid, I would tell you the same thing. This stuff is very dangerous. You need to get off of it. Throw it in the trash. And so I took his advice and I did it. And may Allah guide him and help him and all that, because he really potentially saved my mind. And so it was also already in a little bit, I was kind of almost like in a zombie state. Not totally, because, like he mentioned, it does take a couple of weeks or so for the brain to see it as the new norm. And so, but yeah, throwing that away was amazing. And I'll tell you how I actually cured it shortly. You may feel most comfortable discussing your symptoms with the family doctor initially. Family practice doctors, nurse practitioners, and OB/GYNs are all able to prescribe medication to treat immediate symptoms. Your primary care doctor can also recommend a mental health professional who will assess you and determine which form of psychotherapy or talk therapy may work best for you and your needs. The doctor I saw didn't recommend any therapy. He just said, take the Zoloft. See you soon. See you again soon. While medication can address present symptoms, it isn't a cure-all. It doesn't cure at all, period. You have to take it for the rest of your life. Should you decide to go that route, you'll never be cured. Psychotherapy options, such as cognitive behavioral therapy, which I looked up in the phone book, help identify the underlying cause of anxiety disorders and manage the condition in the long term. Depression doesn't always look a certain way. Bezi, a Healthline sister brand. Anxiety disorders often require psychotherapy to see long-term results. Psychotherapy is very important. One of the aspects I think that really helped me in the beginning, until I found what actually cured my anxiety, was understanding anxiety. The more we learn about something, the more we can equip ourselves with what we need to get through it. You'll find actually a lot of people who have health issues, if they have some type of chronic disease or illness, they become experts in what is ailing them. A lot of them will even get engaged in certain charities for that illness. They become experts. So what we want to do is become experts in many things before it happens. I mean, Allah willing, and nothing bad happens to us, but it's good to learn all of these preventative measures and understand things so that at the slightest hint of it, we can catch it early and reset our sails, so to speak, of our health. So let's move on. If this happens, medication can be prescribed to help you manage your symptoms. There are several ways you can tell that it might be time to consider medication. You feel constantly restless or on edge. Feeling restless and on edge can mean more than just worrying. I never felt constantly restless or on edge. I'm not really sure what this means. I think this is more of almost like an ADHD, almost kind of like stress situation, not so much an anxiety disorder. This article is kind of pushing medication, so we kind of have to take everything here with a grain of salt. We're going to read through it and see what it says. Take the good, leave the weird, leave the bad. But I know I had debilitating panic attacks, but I never just sat around on edge worrying. A big part of anxiety is that you feel okay, normal, like through the day, and then suddenly you can be doing anything. You're making tea, watching TV, whatever it is you're doing, and then suddenly fight or flight kicks in 100 like to the max. So imagine you're sitting reading in the paper, something mundane. It doesn't have to be anything that causes any kind of anxiety. And then suddenly your body turns on the switch of fight or flight as if a lion just walked up in front of you in your living room. This is what it feels like. And this is what made it so terrifying, and why a lot of times you can become a hypochondriac, or you can get agoraphobia. You become hypersensitive to things that are happening in your body. You feel like, oh, I feel a little sensation in my arm. Am I about to have a panic attack? And so then that creates a panic attack. So I never really sat around worrying about anything other than the fact that, yeah, if I got a certain sensation, I would worry that this may be a panic attack coming on, but never restless or on edge. Like, that only happened if I was actually if I was having an anxiety or a panic attack. You may experience panic attacks. Your heart rate and breathing may become rapid, and you may feel a constricting sensation in your chest. When I had my first panic attack, I thought I was having a heart attack because I didn't understand what was happening. And so that made it worse and worse and worse. I'll do a video on the whole ordeal. The story's too long to talk about here. But yeah, cotton mouth, sweaty palms, just fight or flight to the max. And I thought I was dying. While not usually life-threatening, panic attacks can be so alarming that you start to worry about having them. This fear can prevent you from going about your daily routine. Absolutely. You experience physical effects. Constant anxiety and stress can cause many physical symptoms, including stomach aches, headaches, muscle tension. Yeah, you get stomach aches because it interferes with your digestion. When we hear the term, scared the you-know-what out of us, that's true. Every time I'd have a panic attack, it wasn't probably within a few minutes that I had to go to the bathroom. It really does affect your digestion in your stomach. And you get headaches just because of the heart racing. It's like, I think my heart rate with my first panic attack, once I started feeling as though I was calming down and I got to the emergency room because I thought I was having a heart attack, it was 160, 155, 160 when I got to the ER. So that's when I felt like I was calming down. So who knows how I was at its peak when I was having the full-on panic attack. Before I started it, calm down a little bit. Muscle tension, yeah, because fight or flight. We have chemicals in our brain that kick in that get us ready, primed to fight or run. These aches and pains can do more than just make you uncomfortable. You also may find that you experience a change in eating habits, a fluctuation in your weight, an inability or unwillingness to do activities you used to enjoy. I actually turned on the health kick after my first panic attack. I did change my eating habits, but I changed them for the better. I actually lost about 25 pounds. I started eating better. I cut out sugar. I cut out caffeine. So that, just because of my mindset, that's how I am. If things start going wrong, I try to figure out and learn what I can do to fix it. But fluctuation in your weight, I had fluctuation in my weight, not too much, but later I did. So this is true. I did a yo-yo diet over the years. An inability or unwillingness to do activities. Yeah, I just couldn't really do much. I have panic attacks in line at Disneyland. I have panic attacks in elevators. I have panic attacks in the trolley, panic attacks on a bus. Anytime I feel confined in a situation where I couldn't immediately escape, especially flying. You can forget flying. I thought I had a fear of flying, but it was really just my anxiety of being in the plane when the door shut and not being able to flee. That's a lot of, like I'd mentioned, a lot of anxiety builds on not being able to fight or flee. So when you're on a plane, you can't do either. You can try to fight the pilot, but I don't recommend that. Heart palpitations, which can make you feel as though your heart is fluttering or skipping a beat, can happen during moments of intense anxiety. That happened to me when I had my first panic attack. It felt like my heart was breakdancing. In fact, my wife could see my heart beating through my shirt. That's how hard and fast my heart was pumping. You may even feel shortness of breath as your body attempts to increase the levels of oxygen going to your muscles. This is true. You get shortness of breath. In fact, low levels of constant anxiety can bring on what's called air hunger. That's when you have a more shallow breathing, just in general, and you feel like you have to take a breath. This is called air hunger. This can happen, maybe you're low on magnesium, or maybe you just have some underlying anxiety that you're just not aware of or that you just kind of brush off. But these things are important to, again, catch it early so you can get it fixed. Don't let it get out of control. You have trouble sleeping. Lying awake all night with anxiety can significantly affect your sleep. Lack of sleep or sleep deprivation can cause mood shifts and memory issues. It can also increase your chance of developing other medical conditions such as heart disease and diabetes. Absolutely. You have an anxiety disorder when you wake up with a panic attack. So, in other words, this isn't something, you weren't sleeping and worrying about this or that. No, you're dreaming. You're sleeping. And then you wake up with your heart racing with a full-on panic attack, and you run downstairs. At least I did. I would go downstairs And I kind of developed a placebo drink for myself where I'd mix water with apple cider vinegar, and then I'd have a little cup of some Calm magnesium powder with water, and then I would calm down. But this went on for years, and it's the worst when you can't get a full night's sleep. You wake up constantly, and then because when you're having a panic attack, you're literally out of your mind. Even if you know that you're having a panic attack, there's no way to really talk your way out of it. You just got to let it run its course, maybe last for maybe 5 or 10 minutes. Then you're exhausted because it feels like you just ran from a lion for 10 minutes. Even though you didn't go anywhere, your body feels like it. So sleep deprivation. Sleep is one of the most important things we can do. Super underrated. Especially I know as Muslims, we hear stories of the Prophet, peace be upon him, praying all night and all these things. But at the same time, the Prophet, peace be upon him, used to go to bed after Isha most of the time. Sometimes, he would stay up, talk about important matters or answer questions, but for the most part, he would go to bed after Isha. So here on the West Coast, Isha's at 7:30 or something around there. So let's say even 10 o'clock, you go to bed, get up at 4:30, 4 o'clock. Even if you wanted to get up earlier in the night, every hour before midnight is worth 2 hours compared to after midnight. So the earlier we go to bed before midnight, it's okay to get up early during the night. You can get up at 3 o'clock in the morning because the quality of the sleep, it's not how many hours you sleep, it's the quality of the sleep. So get your sleep because yes, heart disease and diabetes, particularly type 2 diabetes, goes up when you don't get enough sleep. This is the time when our bodies rest and repair. Now, if you intermittent fast or if you have a healthy diet, you eat real food, you can get those same benefits while you're awake. You can have autophagy. If you're weight training, you get all these benefits, even if you're not sleeping. So you can get away with 5, 6 hours a day of sleep. I know for, recently, sometimes I get only 6.5 hours sleep on the clock, but quality wise, I'm getting like 7 or 8 because I go to bed at 10 o'clock. So definitely make sleep your highest priority. Otherwise, you'll be sick all the time. You can have mood fluctuations, in your mood. You're not going to be a really nice person to be around. And you're not going to have filters. You're just going to be unhealthy overall. So make sleep a priority. That's just my little side 2 cents for sleep. No, it has nothing to do with anxiety, but that's when I knew I had a disorder, is when I was having panic attacks in my sleep. You feel immobilized with fear. Certain anxiety disorders can cause you to feel paralyzed by fear of certain situations and experiences. Yeah, actually, the paralyzed by fear comes when you're having the panic attack. Social anxiety disorder, for example, may stop you from going out in public places, or agoraphobia. You can also have social anxiety disorder if you have like ADHD and things like this. So we want to make sure we're not getting the symptoms confused. We want to look at things as by their symptoms, not just focused on these labels. But social anxiety for sure, because I know for many years, even now, even still, a little bit, sweat a little bit if I get nervous, but it's much better than it used to be. I used to sweat profusely. I don't know if you saw the movie Airplane when he had to take over the wheel and he's just got sweat pouring. That's almost how I was when just talking to somebody, or if I had to give a talk in front of multiple people. Phobias can cause you to go out of your way, even at your own personal expense, to avoid people, places, or things that cause you to feel anxiety, agoraphobia. You begin to have relationship problems. Anxiety disorders can affect relationships in a number of ways. Changes in mood, increased irritability, and social withdrawal can be confusing and hurtful to loved ones. May Allah reward my wife with Jannat Firdaus for not only supporting me during all those years of my anxiety, but not even complaining, not even bringing it up. In fact, if you were a fly on the wall in our house, you wouldn't even know that she was aware that I was having a panic disorder. Extremely supportive. May Allah reward her for that. You might also have trouble managing your symptoms. All of these symptoms can interfere with relationships at home and work. If you're having issues in your relationships, medications may help balance some of the symptoms responsible. No, say no to medications. Doesn't fix anything. Could even make it worse in the opposite direction. You want to fix these issues. You don't want to treat them. That goes for any health issue. So we'll get to that. Anxiety can make your ability to concentrate fly out the window. This can cause problems at work, and you might suddenly find your job is in jeopardy. Medications may help you find focus again. Not all medications used to treat anxiety disorders are the same. Some have sedative or relaxing effects, while others also work to prevent symptoms of depression. The most common types of medication used for anxiety disorders include anti-anxiety medications, antidepressants, and beta blockers. Benzodiazepines, referred to as anti-anxiety medications, work by creating a mild sedative effect. They're beneficial if you need immediate relief, such as with panic disorder. However, benzodiazepines are often only prescribed for short periods due to their tendency to cause physical and emotional dependence and withdrawal if stopped abruptly or the dose is lowered quickly. After withdrawal from benzodiazepines, anxiety symptoms can worsen. So this is like the behavioral psychologist told me, get off of it right now, because it is highly possible that once you start this, you just can't get off them. The ultimate product. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, work by increasing the amount of available serotonin in the brain, which helps alleviate mood or elevate mood. Yeah, so basically, serotonin, dopamine, any of these neurotransmitters, there's a synaptic cleft between the sending and receiving neuron. And so what these SSRIs do is normally when the neuron releases the serotonin, it does its thing and then it gets taken back into the sending neuron. Well, what these SSRIs do is they block the transport system of it being taken back in. And so now that synapse is being flooded by serotonin, which can elevate your mood. SSRIs are not as fast-acting as benzodiazepines. It generally takes 4 to 12 weeks to respond to an antidepressant. Your doctor will likely evaluate you after 4 to 6 weeks to determine if the medication is working for you. I'm not sure if Zoloft is a SSRI. I think it might be, which is why here it says here it takes 4 to 6 weeks to respond. If your symptoms are being managed, treatment with an antidepressant might continue for at least 1 year. If your doctor decides to stop an antidepressant, it will be gradually tapered off. Though commonly used to treat heart-related conditions such as high blood pressure, beta blockers are also helpful for managing symptoms of anxiety. However, they are only used for performance anxiety such as stage fright and are not typically recommended for other types of anxiety disorders. Please don't take medication for stage fright. This is an abuse of chemicals, in my opinion. You can get over stage fright by just doing it a bunch of times. This is how the amygdala works in our brain, the fight or flight area of our brain called the amygdala. There are other parts of the brain, but the amygdala has an emotional memory. The more you do something, the more it starts to, and as your executive brain kicks in to show and say that, hey, this is not a threat, the brain learns, it adapts. You keep doing it and doing it. If you talk on stage over and over and over, you eventually get better and better. For example, even me talking in front of this camera, it's taken me quite a while to kind of feel comfortable. I don't feel 100% comfortable. My goal is to try to be me in front of the camera, but the more I do it, the more I'm starting to kind of warm up to it and starting to get used to it. But in the beginning, sweating profusely, talking like I was a hostage somewhere. But, you get used to it. You can say this was many YouTubers. They look at their first video and it's like night and day how they were then and how they are now. So, yeah, stage fright, just do it over and over. Eventually, it gets easier. May not get easy, but it can be more bearable. And then we have an advertisement. BetterHelp provides a tailored therapist match, preferred by 95. Okay, so this is all about medication. We're gonna stop here because, let's go on. So if you don't go the medicated route, non-medication treatments options for anxiety disorder include relaxation, such as yoga and Tai Chi. No, just try to pray. One thing with that was negative for me was when I would try to go to the masjid, I would have panic attacks while praying. Because again, you feel closed in, but it's important to fight through it and to force yourself. Because like I said, the more you do it, the brain will start to see that, okay, this is not a time to have fight or flight. You're desensitizing the amygdala. But if you give in and you stop going to the masjid and you say, no, I can't go to the masjid because I'm having a panic attack, you're just perpetuating it and you're solidifying that belief into your brain. So force yourself to go, maybe pray all the way in the back. I would pray all the way in the back. I wouldn't be in the middle because then I really feel trapped. It's like I'm on a plane. So pray in the back where you feel like you could just step away if you need to, but just really kind of get through it. And over time, it'll get easier, inshallah. Deep breathing. Definitely exercise, breathing techniques, breathe in for 4 seconds, hold it for 12 seconds, breathe out for 8 seconds. This was eventually what helped me during my first panic attack. I'd watched some Dr. Wild videos. I've been into this nutrition and stuff for many years, but I remember his breathing techniques. And so I did use that to help me to calm down as much as I could. before my wife drove me to the ER. Hypnosis, don't know about that. Not sure if if you want to do that. Mindfulness techniques, yeah, being in the moment. Acupuncture, I did try acupuncture, but it didn't do anything for me. Maybe I needed to do it more. I don't know. I'm not going to knock it. I didn't try it enough, but that's not what I did to cure mine. Exercise, definitely. Healthy diet. This vague advice given by doctors, healthy diet and exercise, it doesn't help anyone. What is a healthy diet? I'll tell you what I did was keto. I did the keto diet, and a lot of times anxiety can be brought on by blood sugar issues. So if you're pre-diabetic or if you haven't had your fasting insulin test done, I'd recommend you go do that as soon as possible. It's the number one indicator of metabolic disease, which is 85% of the world has. So keto is what, in the end, cured my panic disorder. When the body is unhealthy, the mind follows. I was 40 something pounds overweight, a lot of stress, things going on. Things changed and got better, but the anxiety was always there. So learn about anxiety disorder, learn about how your brain works. Exercise, do weight training. This is great for controlling blood sugar. And try the ketogenic diet or a carnivore diet. I've seen this help a bunch of brothers with their type 2 diabetes and with bipolar disorder, with anxiety disorder, even depression, all types of things like carnivore and healthy keto. I recommend doing that first before you try any medication, inshallah. Really, it's life altering. Often the best outcomes are achieved by approaching anxiety treatment from multiple avenues. Medication can help take the sting out of severe symptoms, while self-initiatives and psychotherapy can help manage anxiety in the long term. All right, so yeah, this was basically medication advertisement. Didn't really touch on, in my opinion, the major indications of it being a disease, or not a disease, of indications of it being a disorder. It is when it's, like they said, if it's affecting your life negatively, if you're unable to work and do all these things, then it's time to take drastic measures. But rather than taking medication that you'd have to take for the rest of your life and that doesn't cure you, I highly recommend and hope that you would do carnivore or a healthy keto. When I say healthy keto, I mean you're just eating beef, you're just eating eggs, maybe salad. But I recommend doing carnivore first, because some people have negative outcomes with vegetables and they don't know it until they're off of it. So I recommend doing keto or carnivore for 90 days and then slowly introduce, different vegetables. And it's the ultimate elimination diet. And it'll do wonders for your health, and especially your mental health. And it's just something you have to do to understand where I'm coming from and why I'm trying to push it. So do that first with medication. If you're already on medication, work with a doctor that's going to help you to get off the medication. Tell them you want to try the natural route. And this isn't some bro science. This is proven thousands of times in different studies and told by many scientists with PhDs and medical doctors and psychiatrists from Stanford and Harvard and all these fancy schools. They all say, and many of them are treating their patients with carnivore or healthy keto, and they're having exceptional results from it. So please give it a try. If you're already, like I said, if you're already on medication, work with a doctor to help you get off the medication. Let them know what you're trying to do. Let them know you're trying to go the natural route. If they're not willing to do it, fire them, find a new doctor. With patience, inshallah, and perseverance, you can cure this. You can cure anxiety like I did. So, inshallah, if you found this beneficial, let me know. Leave some comments, any kind of anxiety or anything you've been dealing with. Be sure to share your wins. Maybe share what you're struggling with. Inshallah, share, like, subscribe to everybody if you found this beneficial. And inshallah, until next time, may Allah reward you for being curious and keep tying your camel. Assalamu alaikum.